Sorry.
Okay. And did my PhD in London, and then I went to Middlesex University, where running a Chinese medicine course, well, a host of complementary medicine courses, and I became the course leader there. So I taught there until 2018, when the course was forced to close, and I took early retirement there. And then now I'm running a Chinese medicine clinic myself. I have been also with the ATCM and the British Acupuncture Council on their board, and all sorts of different things. I've been, doing different roles and so on, and been, the external examiner for quite a number of different courses as well. Now I am actually the external examiner for the course here at the Manchester Academy of Traditional Chinese Medicine. So yeah, that's me. Okay, thanks.
Thank you. Next one. I think I sent the.
I think next one is Dr. Sun.
沈老师.
Oh, it's me. I don't believe I'm the second one, because in the alphabetic order with S.
Should be S, but I put you on the edge.
Anyway, yeah, okay. Yeah, my name is Huijun Shen, and I graduated from Shanghai University of Chinese Medicine in 1982 with a bachelor degree, of course. And then I practiced Chinese medicine in hospital for not long, for less than 3 years, before I started my second degree in Beijing University of Chinese Medicine. And
everyone mute at the moment.
I graduated with master degree from Beijing University of Chinese Medicine in 1988, and since then I have been teaching Chinese medicine in the same university before I came to UK in 1995. So I have been practicing Chinese medicine, including, of course, acupuncture and Chinese herbal medicine mainly, since 1995 in the UK. And in 2005, I started my teaching career again in the acupuncture program at Lincoln University. And the program was transferred to Lincoln College in 2012. So I'm still teaching there. The program is running in Lincoln College, but still with bachelor degree, BSc honors, validated by Open University. And also I have been quite heavily involved in the professional development, professional organization as the Association of Traditional Chinese Medicine and the Acupuncture UK. I have been on board of ATCM Council for 20 years, since 2000 until 2020. And I was the president for 6 years, 2006 to 2012. And I was involved in the government procedure to try to statutorily regulate Chinese medicine together with acupuncture and herbal medicine. So I was on board of the Department of Health. At the time, it's called Department of Health working groups, 2 working groups in 2002 2002 to 2003, and another one in 2013 to 14. But unfortunately, the government, they changed their mind. So the statute regulation is not on board anymore. So that's quite a big shame to our profession. Yeah. And so I teach Chinese medicine in different places. So mainly my full-time job is in Lincoln, of course. And also I teach acupuncture, herbal medicine in Amsterdam and also in Ireland and Spain and Portugal as well. So that's me. Thank you.
Thank you. Next one is, I think is Sui Yun. You're not.
Sorry. Okay. Hello. So quick. Hello, everyone. My name is Sui Yun Huang. I have graduated from Conventional Medicine School, University of Medicine of Guangxi in China, with bachelor degree in 1983. I used to work in Chester Hospital as a cardiologist before I came over to England in 1991. I'm a member of BSC, of course, and the ATCM. I run my own clinic in South Yorkshire. I will be CPD teacher in Manchester Academic Traditional Chinese Medicine School. I will teach MOX, fascial release therapy, and abdominal acupuncture, and gua sha mox fusion therapy as well. Mox fascial release therapy is my own designed and registered with trademark. Mox therapy is that by using the heated mox sac to unidirectionally press stroking on the meridian zone to achieve relax the tension body and the stress. Mox therapy can be used on its own self and also can combined with acupuncture, gua sha, and cupping therapy together, enhance the treatment result because the multiple receptors and proprioceptors in different layers of skin, flesh, fascias, tendons, and organs are reactivate. Altogether, accelerated body recover. It is a safe and a high effective therapies that even for well-being and treatment, MOX therapy is more than welcome by my own client. And also I can teach the abdominal acupuncture. And this is one of the most exciting and innovative form of acupuncture. And like other microform, such as auricular acupuncture, all organs and body parts are contained or reflected within a small area. That advantage of AA or abdominal acupuncture is less pain, more comfortable, and high effective. That's me. Thank you very much. Give me opportunities to meet all of you. God bless. Thank you.
You're going to give them good CPDs. Excellent. I think next one, Jidong, Dr. Wu.
Okay, it's me. My name is Jidong Wu. I am based on Cambridge currently. And before that, I was, of course, like my other colleagues, and I qualified as a traditional Chinese medicine practitioner in China in 1980s, and then worked in the hospital and the universities for over 15 years before I came to UK. Actually, in 5 days' time, I will be stayed in the UK for 28 years. So this is my second home now. Yeah, like Dr. Chen, I used to teach at the Middlesex University until 2017. I also have been teaching in the other European countries, medical schools or acupuncture schools like Ireland, Netherlands, and the other countries. So during the past years, I have been always involved in the education and the training for TCM practitioners. In fact, in 2005, I was one of the person who set up education accreditation board for Traditional Chinese Medicine Association. And I'm still working for that, but I'm not in the main player now. So I'm still doing some teaching and trying to safeguard to monitor the teaching and the training standard in the UK. So today I was invited by Beijing just to give some talk of CPD events. So that's me here. Thank you very much.
Thank you, Dr. Wu. Who is next one? Dr. Ma. Can't hear you, Dr. Ma. Yeah, while we're waiting for him, Dr. Wu is the #1 in Europe to teach FSN. Someone who wanted to learn FSN, oh, it's not here, isn't he? He was invited, but he didn't come yet. Yeah, so hopefully you find this very exciting. I don't know whether Dr. Daf, you also interested. Daf, are you, can you hear us, Dr. Daf from Thailand? He has been to us for the skin condition. So are you able to talk, Dr. Ma?
I think you have to
Move
unmute.
Yeah, Dr. Ma, coming back later. Sure, Jing.
Yeah. To the audio.
Hello, everybody. Good morning. My name is Jing Ye. You will see that word very often in Chinese medicine, but it's not the same. Thank you for coming to this open day. And I would like to thank Dr. Xing to give me this opportunity because I'm a brand new teacher. I haven't got much experience to teach, but I did enjoy. I have a lot of teachers here. Dr. Chen was my supervisor when I was studying master degree in Middlesex University, and Dr. Wu, Dr. Shen, they all used to teach me. I think they probably also taught me in Shanghai University of TCM. I'll just briefly introduce myself to you. I graduated as a TCM doctor from Shanghai University of Traditional Chinese Medicine in 1992. I'm one of the youngest TCM doctor here, but actually I have practiced over, I don't know, nearly 30 years. I then worked as a Chinese medicine doctor, and in China, we normally work as a Chinese and Western medicine integrated medical doctor in hospital for 3 years. And then I decided to change my career. I used to work for Pfizer, one of the best company who's making vaccine nowadays to save the world. So I worked there for 7 years. Then I made another decision to come to the UK to work as a TCM doctor again. Since then, I worked for myself for nearly 20 years. So during that 20 years, I also completed my master degree, as I mentioned earlier. And then I'm a curious person, so I keep studying for my curiosity. That I also learned the postgraduate diploma course with British leading herbalist and acupuncturist Dr. Trevor Wynn in TCM diploma, particularly for gynecology and and obstetrics in 2012. And then I also learned FSN, and Dr. Wu was our FSN Association's chairman. And I also obtained abdominal acupuncture certificate in a couple of years ago. And as you can see, I'm not a professor and I don't have many titles, but I really, really like and enjoy the job. So I also believe that the knowledge you are going to learn will change your life and also will enable you to help others. Thank you.
Thank you, Dr. Ye. Can hear you are so modest. Although you've been working for 30 years, you still think you are very new.
Brand new.
Dr. Ye has been teaching for us. All the feedback from students are excellent. So I would say you are not new, very experienced practitioner and excellent teacher. So Dr. Ma, are you able to talk? Are you able to make sounds now? No, Ma. We can't hear you, sorry. He's struggling to do these technologies. Next, who is next one?
Can you hear me now?
Oh, I can hear you now.
Can you hear me
Finally.
now?
Finally, please.
Oh, my goodness.
I think your mic was off.
All right, okay. I'm here now. Anyway,
Yeah.
my name is Jimmy Ma. Jimmy Ma. Some people call me Jimmy Ma, but most people call me Max. Okay. Actually, I used to work for Xu Zong and Zhang Daifu, Zhang Yaxiong. I used to work for them. Okay, before I came to the UK, I practiced Chinese medicine in different hospitals for a few years. Okay, first of all, I would introduce myself. The first acupuncture study. Actually, before I studied the acupuncture, I learned some acupuncture Chinese medicine from my parents because my father is a good Chinese medicine doctor as well as the West medicine. I studied the acupuncture and the Tuinar in Shandong TCM College in Laiyang and 1983 to 1986. And then I work in the hospital, in Zibo Hospital. But further on, I studied the Shandong University of Chinese medicine, mainly the herbal medicine, in 1987 to 1991. That's the part-time study, the 4 years there. And same time, I studied the English and studied my Chinese medicine and West medicine, a lot of things. Luckily, in 1998, I passed the entrance examination in China for the master degree. So I studied my master degree from the 1998 to 2001. I studied the acupuncture for the obesity and the diabetes. Followed Dr. Zhicheng Liu, the famous professor in China. Okay, this is my education, the background. And also my working experience. I mentioned I used to work for Shenzhen when I came to the UK, and based in the Newcastle and a little bit in the Guildford. I would say after the 2006 until now, I worked for in South Shields in the King Street for myself, and the practice acupuncture and the Chinese medicine and the Tuina massage, something. And also, before I came to the UK, I said I used to work for Zibo Hospital for 12 years and work in different departments, the elderly disease department and stroke department and the A&E department. Few departments work there. And also I used to work in the Hangzhou for a short time, about 6 months, in the acupuncture department and interpreter for the foreign students there. During my study in Nanjing, I used to be the interpreter and the clinical teacher to teach to bring the foreign students to practice acupuncture, Chinese medicine in different departments in Nanjing, and include I think all of them, the hospital in Nanjing. Anyway, so I think the Xinmei have this college. That's a very, very good idea, and because we through the COVID pandemic and through so many, because I practiced in the UK so many years, about nearly 20 years, I found a lot of the things cannot help from the hospital, NHS, but we can do easily to help them. So we need the people to continue to do this job, to help the people, to help the people and to maintain the people's quality of life. I would like to encourage the people to come to study and to let your friends, your family, everybody, and to study, to practice, and let the Chinese medicine to continue to grow and more glorious future. Okay, thank you everybody. Thank you.
Excellent. Yes, Dr. Ma, indeed, we all see the beauty of Chinese medicine. I think we are all passionate about it. Anyway, thanks, Dr. Ma. Next one is Dr. Zhu, our king of the skin disease. Where is Dr. Zhu? Disappeared? 朱老师.
Can you hear me?
Yes, I can hear you now.
Okay.
Hey,
Okay.
hey, hey.
Hi. Good morning.
Yes, good morning.
Good morning, everyone. Good morning, everyone. It is my great honor to join this wonderful teaching team at MATCM, led by Dr. Mei Xin, who you will all find soon is an amazing lady. She's very, very attractive, intelligent, ambitious, and utterly competent. Anyway, my name is Baifan Zhu. I graduated from Hunan University of Traditional Chinese Medicine in 1984 with my first and second degree in TCM. I had worked as a TCM dermatologist and surgeon at the teaching hospital of Hunan University of TCM for more than 10 years before coming here, where I was also a senior lecturer and deputy director of university. And I have worked at my own TCM clinic in London since 1994. Today, I'm extremely glad to be here with you and welcome all our new students to join the MATCM courses and thereafter enjoy them. In the meantime, I can't wait to share my clinic and teaching knowledges with our new students. I'll do my best. Good luck to you all. Thank you.
Thank you, Dr. Zhu. I think some of our herbal students are here, has experienced Dr. Zhu's teaching. I believe you still feel impressive, yeah?
Thank you.
And last one, well, anyway, you will know more about Dr. Zhu if you join our herbal course. He will be teaching skin conditions. He's a world famous skin specialist. Okay, let's pass on to Dr. Zhang. Dr. Zhang,
Finally, introduce myself.
touch my tea.
Hello?
Just carry on, Dr. Zhang.
All right, you can hear me
My tea.
clear? Hi, right, everyone. Yeah, I'm Yashong Zhong Zhang. I'm graduated from the University of Portsmouth in 2005. The honors degree of the Bachelor of Science in Acupuncture. I'm the member of the BCC British Acupuncture Council and the BMAS British Medical Acupuncture Association. Instead of the teaching experience, I'd like to introduce to you a bit more about my specialty. My specialty is using the in-depth of science, anatomy, physiology, and pathology analysis to treat the muscles and the joints pain and the internal organ diseases. The technique I use mainly includes three aspects. The first one is the light-handed osteopath Chinese style for skeleton and joints adjustment. 新手正骨. It needs the knowledge of the anatomy of the skeletons, ligaments, joints, and muscles. The second method is the full subcutaneous needling for tight muscle, or you can call it the muscle point release to the muscle pain and the joint pain, which is Dr. Wu's specialty as well. The third method is the flat head needling style for stubborn pain and internal organ diseases, Chinese called Pizhen or Zhendao. In order to understand it a bit easier, right, I just give you an example. So it's like when I treat shoulder joint pain, if a patient is quite scared of acupuncture needle treatment or suspect the potential partial dislocation of the shoulder joints, I will first start with a light-handed Chinese style osteopath for shoulder joint repositioning, or using special manipulation to loosen up or repair the relevant muscle groups. This is not trainer, because it's purely based on the skeleton joints and muscular anatomy knowledge for the manipulation instead of using acupuncture meridian theory. If the patient is not afraid of the needle much, and I suspect that the shoulder pain mainly caused by the muscular tensions, just like a rotator's cuff muscle groups or deltoid muscle tension, I will use a full subcutaneous needling method to loosen up the rotator's cuff muscle groups. In this case, it's like the front of a supraspinatus underneath of a spine of a scapula, the infrascapular, right, or the teres minus, or front of the scapula of the subscapularis, or the biggest of the muscles, the joints of the deltoid, releasing tension. The third method, if the shoulder joint pain is chronic and stubborn and difficult to treat, such as like frozen shoulder, I will use flat head needling method to treat the rotator's cuff muscle I mentioned before, and applause. I might need some special position after palpation, such as like the coracoid process there for its muscles and ligaments attachment to release the high tension points. In this case, like the coracoid process attachment muscles are like the short head of biceps brachii, the pectoralis minor, which is attached to the third and fifth of the ribs, or the coracoid brachial muscle. And for the treatment of that, I might even use like a location of the biceps brachii of the long head in between the greater tubercle and lesser tubercle of the groove, because this is very effective to treat a stubborn frozen shoulder, especially for the rotation of the backwards, getting difficult with the frozen shoulder patients.
Have you finished?
Not yet, not yet. Okay, let me see
Just
what I want
focus on
to say.
introduce yourself. I think you have.
Okay, just a second.
Explained
Just to
wonderfully.
introduce a bit more things down. Right. Third method of flat head acupuncture is also very efficient for the internal organ forgot to mention that, such as like heart problems, you might surprise, right? It can treat heart problems or digestion problems with the needling, but by using the treatment of the autonomic nervous system, which includes the sympathetic and parasympathetic nervous system, and mainly it's treated through the back of the neck or the sacrum region of the body, right? Okay, I leave it to you then. My introduction is up to
I
you.
think Dr.
Into the
Zhang is
details,
very, very passionate.
Yeah,
about
it's a Western
treatment.
medicine and Chinese medicine combination. Okay, thank you. Leave it to you.
He's very passionate. He almost wants to use this opportunity to teach. He always talk and teach all the time. So we will give you a chance anyway sometime in the future to give our students a wonderful lecture. It's great. But of course, we have other people to introduce. Dr. Xiang Yang.
Thank you.
Make sure we will save a bit short. 2 minutes about yourself. We move on.
Basically, I'm a more clinician rather than educational, and then basically I have been practicing Chinese medicine for more than 30 years, and then of course I have a little bit of teaching background in China and in the UK. Like Dr. Shen, I was working with as a colleague with Dr. Shen between 2008 and 2014. So that's all about me. Thank you, Dr. May.
That's a bit too short. Probably scared of me pushing you. Anyway, wonderful. I think, I believe everyone should be feeling impressed about our tutor teams. Everyone, if we are still in China, we are senior professors, no doubt. Thanks for all of you, and some of you are very passionate to deliver, already started. And I know, and also everyone's time is a treasure for you, but still spend time to introduce yourself here. So I hope we'll meet students more later on. But next program is, I'm very honored to invite Professor Li-Qing Zhao, who is the president of from ATCM, where our course accredited from. So she will give a short speech and just basically introduce ATCM and also give you a little bit encouragement about ATCM, about to study Chinese medicine. So please, Li-Qing.
Thank you very much, May. Hello, everyone. Good morning. It's lovely to see you all here. Can you hear me?
Yeah.
Yeah, okay, great. So I would like to say, just a few words to take this great opportunity. Thank you to Dr. May Xing. Anyway, I'm Li-Qing Zhao from ATCM, the Association of Traditional Chinese Medicine and Acupuncture UK. I'm very honored, as I said, to be invited to the open day of the Manchester Academy of TCM. So it is really nice to see you all here on this special occasion. And firstly, I would like to thank to my dear friend and my dear colleague, Dr. Xing, the beautiful and talented lady. We know each other for years. So obviously she's the director of the MATCM. So thank you for your, again, kind invitation. So on behalf of the 16th ATCM, which is very similar to your name, ATCM Council, I would like to send our very sincere wishes to you for a great successful open day. As we know, health is a common pursuit of all mankind. TCM is the traditional Chinese culture treasure, as we all know. And the interest in TCM has grown vastly in the UK. and the world really needs our TCM. And TCM has been widely used in the whole world for years and has benefited thousands and millions of people. During this global pandemic, TCM helped numerous patients and families and made a great contribution to the world. ATCM was established in 1994, and it is one of the main self-regulated professional body in the UK. So we have about 700 members. So if I remember, I think it's about 25% of the practitioners were trained in the UK, and 75% of the members were qualified in China, which have at least a bachelor degree or many masters and PhD. So ATCM always strive to promote TCM and acupuncture profession. We have been working closely with the Department of Health of British government. Professor Mei Xin has been a member of ATCM for years. I can't remember how many, but I know she's been a member for years. So she has made a great contribution to acupuncture in Chinese medicine as a practitioner, educator, and a researcher. So Mei has been very passionate about the necessity and importance of teaching authentic TCM to a new generation of practitioners in the UK. Whenever we talk about that, I can always see her passion about it. So therefore, she founded MATCM, the Manchester Academy of Traditional Chinese Medicine, in 2015 or 16, sometime around then. And also MATCM is one of our ATCM's accredited TCM college. So we have been working together with MATCM and of course other TCM colleges and professional organizations for years. So we will of course continuously collaborate with them to promote TCM and acupuncture profession, and of course to benefit the UK residents and also the people in the world. So ATCM has been always actively engaged in academic study and ongoing research into the clinical application of TCM. So it is imperative to help modern TCM practitioners to develop their skills and understanding to ensure they grasp the basic concept of the knowledge and the wisdom behind the medicine. So MATCM, you offers postgraduate diploma courses and also a lot of different CPD courses. So like dermatology, gynecology, fertility, which have been there a couple of times. So I believe that all of our colleagues, all new students, would gain a lot from their high standard teaching, and also growing your skills and achieve expertise if you want to like specialize with any certain areas like dermatology or pain relief or gynecology, etc. And it will thrive in your profession, benefit again the patients as well. There is a big demand in this country. So I really do think this is a brilliant move forward, how to grow the TCM and the acupuncture profession, and again to hopefully have more people to practice. So anyway, again, finally, I would like to sincerely wish the MATCM will do better and better. And also, I would like to thank Dr. Xin again once more for offering this opportunity for me to meet up with all the colleagues, and wish you all have a great day, and I'm sure you will. Thank you.
Thank you very much, Dr. Zhao. Yes, I'm very passionate, so as other tutors. That's very true, to deliver this beautiful medicine, Chinese medicine, and to more people, obviously. And that's why we are here. I hope all the new students also will gradually feel like inspired and passionate about it. And we move on next. Dr. Xu is a managing director from Shizhen Company. The reason I invite these two or so-called distinguished or special guests, one reason is from ATCM, another is from the wholesale market, wholesale company, because he got the best evidence to see how Chinese medicine, how to say, flourished in this country. I think, especially during the COVID, every business being affected. I believe the TCM is not as much as what other kinds of businesses. So of course we are the practitioner, we are doctor, we are the therapist, but at the same time we have to be realistically realize we are also business kind of how to say, in the business side, because we have to be self-employed, self-fund, and support ourselves. So let's welcome Dr. Xu. Give her a short talk about his opinion about TCM. Welcome, Dr. Xu.
Well, yeah, you can hear me. Yeah.
Yes, very well.
Anyway, it's a great pleasure to be invited to the open day of this particular event. And honestly, it has been for many years, we have been working together with Professor Xi and also the colleagues. So anyway, first of all, may I congratulate the successful opening of the event today. And also, as always, very delighted to see old friends, more so at this challenging time. We haven't been seeing each other, or many of you, for many years now, 2 years, not many years, because of the COVID. Yeah. Very sadly, we have suffered and are still suffering from the COVID-19. However, something good comes out of the fight in the pandemic. TCM, as a medical system, has shown its strength in antiviral and anti-inflammatory effects in the management of the COVID-19. I'm very proud of Professor Xi. She helped quite a few COVID patients who I referred to her. So many people came to me when they had the COVID, asked for help. And very thankful to Dr. Xi, because we had very good results, and all of them have fully recovered. And in a particular case, which a Chinese medicine doctor, yeah, and that day, both Professor Xi and myself worked hard, and especially the Professor Xi talked to the patient in the hospital, and he was actually in the intensive care. And at the time, his mind was confused. He couldn't talk properly, and he lost his mind temporarily and come back again. So he was very confused. But luckily, and Professor Xi helped him, and he had a full recovery, and now is practicing the medicine again. And this is a brilliant story I'd like to share with everyone here. The TCM has come to the UK for many decades. And we all see its dramatic the development over the years. And we all know it relied mainly on the Medicines Act 1968, section 12.1 and section 12.2. And still today, we are using the same legal status for practicing the Chinese medicine. And in the past so many decades, we had a great number of the new generation of scholars and practitioners from mainland China, like the principal and the lecturers of the Manchester Academy of TCM, who worked hard to promote the development of TCM in the UK. I think I'd like to share this with our new friends and the students possibly, and they may not know the background of who you are. And this, I think, may help them to know more about you. China had an educational reform in 1977. The reform had a new exam systems and also to be selective for the students to go to universities. And the universities become more academic and the research-oriented institutions. So as our lecturers has pointed out, they said the majority of them, they are graduated from 80s. So our new friends may wish to know, 1982 was the first group graduate going out of the university to, especially to the all works of life. Traditional Chinese medicine is one of them. So some of you graduated in 1982. That was the first reformed graduate from the universities. So all of them are brilliant. They are selected from one from possibly hundreds. So all the lecturers and the professors are brilliant. So our new friends, you should trust them. You could do better, do well in Professor Xin's Academy of the Traditional Chinese Medicine. And because of time, we have been dragged on for quite long now, so I want to cut short. But anyway, personally, I benefited from the Traditional Chinese Medicine because I had a chronic sinusitis for many years. And with the management of Chinese medicine, it helped me. I didn't have to go to bed to sleep for 2 days, 3 days, no longer at all. Okay, so this is why I'm here. And we have involved in the Chinese medicine. We are the suppliers of Chinese medicine, from acupuncture needles to patents to dried herbs. Finally, thank you, Professor Xin, for organizing such a wonderful open day. This is not only beneficial to the community, but also to the Chinese medicine itself. And I hope our students, our new friends, will have a brilliant future, because Chinese medicine does help. And thank you all.
Thank you very much, Dr. Xu. Very encouraging and inspiring, hopefully. So thanks to all of